All right, now we will start. And this is about this is a very important topic because contraindication and precaution for immunization. You must know exactly what is the contraindication, exactly what is the precaution when you give an immunization. Because yesterday, after the class was over, I don't know whether day for yesterday, Rose asked me over the phone, a patient was given immunization in a health center, and after the primary 6-month-old infant, I think, was given all the injections, including pentavalent. And suddenly her eyes went up, and for some time, I think she was unconscious, or the rest she doesn't know. She had a reaction, that's all she knows. And she has come to Astor Hospital. And what should be the advice to her? What will be your advice, Dr. Gopiga? This is a real life situation. Dr. Nyangala, we went to the first place. What will you do in such a situation? Gobia, you are there?
Yes, sir. We'll counsel them. That is, this is the adverse reaction following the immunization.
Okay.
And if
Now the question is the next immunization, what you're going to do. You can answer, one of you can answer. Hello, Lasima, or
Sir,
yeah, give the answer fast, otherwise you are wasting time. Yeah.
sir,
Maybe.
next.
What did you do? You want to answer or not answer? You can't escape this.
According to the reaction severity, is it critical, serious?
Yeah, I agree, but this is what it is in real life. They don't come and say we had a critical reaction. Health center, which the immunization was given, doctor, and this is what happened. Now they are afraid to give the second dose. I come to your hospital. What will you do? I'm just asking. I'm not asking theory. I'm asking the whole reason why I'm taking these classes is that to emphasize in practice, you may attend 100 CMEs, you may give 1,000, 5,000 rupees for registration for workshop. Finally, when it comes to you, you don't know what to do. This is what it shows. Gopika, you are there. What will you do? Gopika has gone, I think.
no, sir.
Yeah. What will you do? Patient comes to your clinic. Yeah.
We'll counsel them regarding the precautions in the next vaccination.
Yeah, he has come for the next vaccination. There's no question of counseling. Doctor, can you give or not give? That's the question. Will you give or not give? Well, here the answer is Rose said that the most important thing is I told Rose you should get a full report from the first place. What really happened? Now, if she says that it is taken in a health center, probably by an A&M, and there's no report, then you should record it. Then you should tell from the mother the history, minute by minute, what happened. Was the child, what was the reaction? Then you'll have to make a differentiation between hypertonic, hyper-responsive reaction and an anaphylactic shock. Now, if it goes, then Rose was telling me that they gave DTWP vaccine, wholesale vaccine in the health center. Shall we give DTAP vaccine? What's your answer to that? I think you were listening to me when I talked to Rose. Gopika, what's your answer to that? See, after listening to the whole of Ramayana, you don't know who Rama and Sita are related is going to be very difficult. Because the whole reason why I'm teaching you all this is knowing fundamental things. Now, the consensus of opinion, it looks like Rose was telling me that why don't we give her what do you call DTAP vaccine instead of DTWP? What do you say?
The
Yeah.
hyporesponsive episode, if it is, then it's not a contraindication, sir. We can give.
Okay. Now, but we don't know whether it's anaphylaxis. If it is anaphylaxis, what do you think? Why I'm
If it is
stopping this
anaphylaxis,
discussion and
then there is
asking
a
you this question
contraindication,
is,
sir.
these are the
Severe.
real life situation. Okay, Gopika, you talk. I will listen to you. What did you say?
It is an anaphylaxis, then it is a contraindication, sir.
Yeah, it's a contraindication to one vaccine. DTWP is a contraindication to DTAP also. There's a basic principle. Therefore, if you are telling that the previous one is an anaphylaxis, then you cannot give this vaccine again. Definitely, you can't give all the three vaccines. Now, that's a very terrible decision. He might get diphtheria, he may get tetanus, okay. Therefore, this would come under classification of this is where I would like to say that you like to say from the history, it looks like hypotonic, hypo responsive response. Write it down, make a sign, or write it down as nice guidelines, suspected anaphylaxis. It's not approved anaphylaxis. And then you give the vac. Probably you should err on the giving, but you should take everybody into confidence. The parents, the hospital, be ready for a reaction, everything. Anyway, that's why I say medicine is not that easy as you think. When you start practicing, it's very difficult. Well, if you are in a health center, the best thing is to go to the medical college. I can tell you for once, from the private, if you send to the medical college, they won't take the responsibility. If you are in the health center, government service, and you send it to a medical college, they have to take the responsibility. That's how it is. Anyway, now read the first thing now. It's not moved. Okay, can you read?
Which of the following best defines a contraindication to vaccination? A condition that might increase the risk of a serious adverse reaction but allows vaccination if benefit outweighs the risk. A condition that increases the risk for a serious adverse reaction and under which vaccine should not be administered. A condition that causes diagnostic confusion between vaccine reaction and underlying illness. A temporary condition that always requires postponement of vaccination. Condition that increases the
B.
Is the answer?
B, sir.
Okay.
B.
Yeah, there's the basic difference between contraindication and precaution. Is not that easy. It is confusing, but now you read it now, the explanation.
Contraindications are conditions where the risk of a serious adverse reaction is high enough that vaccination should not be administered. Most are temporary, allowing vaccination later when the condition resolves.
As a little, at that particular point of time, that's what they say, you cannot give. Okay. But if it's a precaution, you would postpone it. You can, if the risk outweigh the what you call the benefit outweighs the risk, like what the condition in which I said, because there's a very high chance that it is HHA, and therefore you can. Now we are not sure that it is not an anaphylaxis. Therefore, you might think that the benefit outweighs the risk, but that risk has to be taken by everybody, by the parents, by the parents say no, 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 doctor, don't give. You cannot give. Okay, now read the next question.
What is the primary difference between a contraindication and a precaution for vaccination? A contraindication is permanent, a precaution is temporary. B, a contraindication indicates absolute avoidance. A precaution may allow vaccination if benefits outweighs the risk. A precaution applies only to live vaccine. Contraindication apply to all vaccines. D, a contraindication involves anaphylaxis. A precaution involves fever.
What do you think?
B, sir.
Oh, okay, the B, okay. Read the answer.
A contraindication indicates contraindications are absolute reasons not to vaccinate. Precaution suggests deferral or caution, but vaccination may proceed if the benefit exceeds the risk.
Okay, that will be a very difficult task, is it not? When we are defensive, you are giving vaccination to a healthy child. Remember this. If the patient collapses and dies, there'll be an uproar like anything. Therefore, you have to be very, very careful when you cannot decide on your own if the benefit exceeds the risk. You explain to the patient, get it in writing, let them. If the mother alone is coming, I would tell them to go and discuss with the family parent, come back, and then only give. This is because it's a major decision, a more major decision than taking consent for surgery. I'm telling you. Okay, now read it now.
Contraindications. Contraindications are conditions in a recipient that increases the risk for a serious adverse reaction to vaccination or conditions under which vaccine should not be administered. Because the majority of contraindications are temporary, vaccination often can be administered later when the condition leading to a contraindication no longer exists.
Vaccine should not be admitted. Okay, go with it. Okay.
And contraindications, permanent and temporary. Permanent, severe anaphylaxis, SCID to rotavirus vaccine, and temporary is pregnancy and immunosuppression.
See, what you must note here is this is where the medical legal angle will come. Once you have diagnosed severe anaphylaxis, it becomes a permanent contraindication. Now, the problem is you have not diagnosed it, but you have given adrenaline because adrenaline should be given when you are in doubt. Therefore, they can ask you, you gave adrenaline, therefore it was anaphylaxis. No, you can say that when there is a suspicion, we have to give. Later, when we look back into it, probably we can say it is not an anaphylaxis. There's a many major problem which even your pediatrician who comes to be your what they call the professional person in an inquiry, the medical director and the others will never understand. They will never have the IQ to know this. Remember this difference. We cannot postpone giving adrenaline more than 5 minutes. By the time a child collapses, by the time you take the vaccine, you get the adrenaline and is ready, it is almost 5 minutes. You may have to give it at that time. But later you might realize that it was not an anaphylaxis for some reason. Therefore, then you'll have to document it. But anyway, once you have said it is anaphylaxis, then it will be very dangerous to give because it's a permanent contraindication. SCID is severe combined immunodeficiency. If you even OPV is contraindicated, that we will come to that later. Pregnancy and immunosuppression are immediate contraindication. Now, what is precaution? Can you read? Yeah. Read, please.
Precaution is a condition in a recipient that might increase the risk for a serious adverse reaction, might cause diagnostic confusion, or might compromise the ability of the vaccine to produce immunity. Example, administering measles vaccine to a person with passive immunity to measles from a blood transfusion administered up to 7 months prior. A person might experience a more severe reaction to this vaccine than would have otherwise been expected. However, the risk for this happening is less than the risk expected with a contraindication.
Okay, therefore, I'm sorry, it went somewhere else, I think. My screen went. I don't know what happened to my screen. Okay. Let me share. Okay, therefore, I think now we got it. Amal has also joined, I think. Amal, how are you? You are in call or what?
PAC duties
അവിടെ patient ഉണ്ടോ? Is there
ഉണ്ട്
a
സർ. ഒരാൾ
what patient?
ഒരു ബ്രോങ്കോ ന്യൂമോണിയ വിത്ത് വീസ് സർ.
Is there a
ഓൺ
diagnosis?
വെഞ്ചുറി മാസ്ക് ആണ്. വെഞ്ചുറി മാസ്ക്.
Okay. What was the SPO2 before you put him on the PICU?
SPO2 87% on room airs. 82 to 87.
But did you give on nasal cannula oxygen, or did you give on?
So initially you are started on HHFMC, but then also the saturation didn't pick up. So was changed to NIV. And now we went off to Venturi mask.
Okay, it was so severe, huh?
Yes, sir. The child was having grunt, also severe grunting.
How old is the
Audible
child?
is
3 years.
3 years. Okay, we'll discuss about it later. I mean, if there is time after this. So if it's a precautions, a condition, okay, you have read this, isn't it? A person might experience a severe reaction to a vaccine, otherwise be. However, the risk of this happening is less than the risk expected, is not a contraindication. Okay. A precautions, a condition recipient that might increase the risk of serious adverse, might cause diagnostic confusion, or might cause compromise the ability of the vaccine to produce immunity. That's a precaution. They say it's a temporary thing. Okay, now next. Right? Can you read it?
precautions. In general, vaccination should be deferred when a precaution is present.
Okay, carry on. Read it as.
Or a vaccination might be indicated in the presence of a precaution if the benefit of protection from the vaccine outweighs the risk for an adverse reaction. The presence of a moderate or severe acute illness with or without a fever is a precaution to administration of all vaccines. The decision to administer or delay vaccination because of a current or recent acute illness depends on the severity of symptoms and etiology of the condition.
We will come into the discussion because acute illness is a very major problem which you will face. Note that these references are from the CDC. Why I'm putting it into this is to show you that even maybe the purple book does not discuss this in detail. We want a full discussion. We want to know when we can postpone. Nobody should be able to postpone, question you when you postpone. Similarly, when is it a contraindication? No, we should be the final authority on it, and you should know the source of information. Okay. Can you tell me?
A child has a moderate acute illness with fever. What is the recommended approach to vaccination? Administer all vaccines as scheduled. B. Administer only inactivated vaccines. C. Postpone vaccination until the illness resolves. D. Administer vaccines but monitor closely for side effects. Postpone vaccination until the illness.
Yeah, here the most important thing is they have said that moderate illness postponed, mild illness give. That's the answer. What is moderate and severe? I don't know. Can I read it now? Answer. Quick.
Moderate or severe acute illness is a precaution. Vaccination should be postponed to avoid superimposing vaccine reactions on the illness and to prevent diagnostic confusion.
Okay, read it.
Which of the following is not a precaution for vaccination? A. Mild upper respiratory tract infection. B. Recent hospitalization. C. Personal history of seizures. D. Moderate diarrhea.
Yes. This is no difficult. It's not a
Mild upper respiratory.
but I
No,
don't know.
not a precaution.
Recent history of hospital is not a precaution. I don't know whether personal history of seizure is a precaution. Moderate diarrhea, maybe. Recent hospitalization, how is it a precaution? I don't know. Anyway, the answer you gave is right. Mild illness like upper respiratory tract infection, mild diarrhea. This is written moderate diarrhea. That's why otitis media are not precaution. See, this is the problem in MCQs, they take up a question and they may ask you even in the NEET exam without understanding the fundamental of it. This is what is a mild and moderate diarrhea? How can a recent hospitalization be is not a precaution? It's not a precaution, definitely. Recent hospitalization. I don't know. Anyway, the next question. See, immunization during illness is a very important topic, which you will see. Now, I'll ask you a question. You are sitting in the OPD, Dr. Let's say Amal. I will ask Amal because Amal is going to be the consultant pediatrician because I have seen the result he has passed. Okay. Amal, you are there?
Yes, sir.
Yeah. I saw on the website you have passed. Okay. It's not announced. I'm simply joking. Now you go to the health center. A child comes to you for immunization, fever and cough and cold and a running nose. And the fever is 38-degree temperature. And you treat paracetamol and everything. In Oman, what happens first? They come to the sister. The sister checks the immunization. The moment you write the medicine, she will be standing by your side. Doctor, this child has missed. She's 8 months. She has missed the 14th week injection. Can you give the immunization now? That's what she will ask. And if you say no or yes, it will be recorded. Okay. Now you tell me, Amal, you are going to and practicing. Where are you posted?
I am posted in a Taluk Hospital, Kottarakara,
Oh,
Kollam
you have
district.
political connections, I think. Okay.
No, sir.
You have good political
I
connections with the leftist. Okay. Otherwise, straight posting in a Taluk hospital is very difficult. Okay. Anyway, in the Taluk hospital also you get a patient. Taluk hospital where? Kottarakara. Okay.
And now, after PG, they are posting only Taluk Hospital, Ebola.
Poor Dr. Amrita served 7 years in, and she was not in a Taluk hospital. Poor Dr. Amrita. And she's a consultant here. After her MD in Kottayam Medical College. Remember that. Anyway, now you are lucky in that way. Now, my asking to you is very simple. You are sitting in the OPD, the patient comes to you, and the patient has missed a dose at 6, 10, and 14 weeks she has missed, is already 8 months old. Now, he has the question we asked is, I don't know how it went back or forward. Anyway, the patient has, this was the question, is it not? No, okay. Mild illness, he has a fever and he has got a 38-degree temperature and cold. Will you give or will you not give?
Not gives.
The problem of not giving, I'll get back to you. Then now read it. Immunization during illness. You read it, Amal.
Immunization during illness. Immunization during acute illness may lead to lower immunogenicity or vaccine failure. Hence, vaccination should be postponed in a moderate or severe acute illness, and parents instructed to return for the vaccination when the illness resolves. Vaccination is also postponed to avoid superimposing vaccine reaction on the underlying illness and mistakenly attribute to a manifestation of underlying illness to the vaccination.
That's a very important point, most important for us. The child might be developing a pneumonia or it may be developing some other illness, maybe developing a meningitis. You go and give the injection, they will attribute to it. But what is written here is very important. They have made a statement here that it is in moderate or severe acute illness, but they have not mentioned what is moderate. But what is the other point? Okay, now read the double. They talk in double words. Okay, read it.
However, vaccination opportunity should not be missed during minor illness such as upper respiratory tract infection, mild diarrhea, or otitis media.
Okay, that is the most important thing. When Dr. Elsie Philip madam was there, Suna madam was there, she was very particular about this. Don't miss an opportunity to vaccinate the child, because every contact with the health personnel should be an opportunity to vaccinate. Therefore, minor illness, whenever we used to discharge the patient from the ward, even after severe pneumonia, we would, if the patient is not taking vaccination, he's unlikely to come back, then we would immediately give it. But those days are gone. We are having protective practice. Therefore, Amal, I would say discuss with the parents and try to get a reporting. Okay, now precautions continue.
Precaution. The safety and efficacy of vaccinating persons who have mild illnesses have been documented. Vaccination should be deferred for persons with moderate or severe acute illness. This precaution avoids causing diagnostic confusion between manifestation of the underlying illness and possible adverse effects of vaccination, or superimposing adverse effects of the vaccine on the underlying illness. Among persons whose compliance with medical care cannot be ensured, use of every opportunity to administer appropriate vaccine is critical.
Therefore, their last statement is there's a double statement. Therefore, If the patient is not taking, suppose it's an unimmunized child, then definitely use it. That's what they have written. But at the same time, they say that these are the people who will blame your vaccine for everything. But remember this very carefully. But individual basis you will have to take. You will have to take the patient the confidence. If the patient says, no, 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 I am not going to take, no, leave it. That's your problem. Okay. Read it now. Has the slide not changed?
Yes, sir.
Yeah, read it.
Hospitalization should be used as an opportunity to provide recommended vaccinations. Healthcare facilities are held to standards of offering influenza vaccine for hospitalized patients. So providers are incentivized to vaccinate
Yeah. Yeah.
these patients at some point during hospitalization. Current, recent, or upcoming anesthesia, surgery, or hospitalization is not a contraindication to vaccination, but certain factors might lead a provider to consider current, recent, or upcoming anesthesia, surgery, or hospitalization as a precaution. Effort should be made to ensure vaccine administration during the hospitalization or at discharge.
See, the problem is the patient may be due for hernia and everything will be fixed. He will come for pre-hospital checkup. You find that he is not immunized against measles. You will go and give measles vaccination and the patient may develop fever. Therefore, you will have to weigh everything before you give. Therefore, it's a precaution. At the same time, it's not good to send a child without immunization also. Therefore, precaution, the responsibility is on you. Remember this. Okay.
A personal or family history of seizure is a precaution for MMRV vaccination. This is because a recent study found an increased risk of febrile seizures in children 12 to 23 months who receive MMR vaccine compared with MMR and varicella vaccine. Routine physical examination and procedures, example measuring temperatures, are not prerequisite for vaccinating person who appear to be healthy. The provider should ask the parent or guardian if the child is ill. If the child has a moderate or severe illness, the vaccination should be postponed.
But I would say that when you are in a private hospital, private setup, you better check the temperature. So, because tomorrow the patient might say, we went to them, they gave the vaccination, they did not even check the vitals. Always remember, check the vitals, check the temperature. If the temperature is 40 or 39, don't give. You understand? But this is a government service, they're probably telling. But in their days have changed. Therefore, I would go and check the temperature. Okay. Regarding the seizure, I will come to it. Now,
A child develops a
hypertonic.
hyporesponsive episode within 48 hours after DTP vaccine. What is the appropriate next step? A. Permanently defer all future doses of DTaP. Do not administer any further purchases containing vaccines. This is a precaution, but subsequent doses can be given safely. Only administer diphtheria and tetanus vaccine, avoiding pertussis component.
What is the answer?
This is a precaution, but
Okay, this is a okay. Remember, read it.
hypotonic hyporesponsive episode within 48 hours of DTP is a precaution, not a contraindication. Most children can be safely revaccinated without recurrence. The advent of acellular vaccines has reduced the risk.
Dr. Amal, I will ask you a question. Now we say if it is hypertonic, hyporesponsive response, it is a precaution. You can give the vaccination. If it's an anaphylaxis, it's a contraindication. There also the patient will become hypotonic and hyporesponsive. What's the difference between anaphylaxis and hypotonic, hyporesponsive? How will you differentiate between these two?
One is a contraindication and
That's okay. And clinically, how do you know whether it is HHG or anaphylaxis? I'm asking Amal. Amal is there because Amal isn't going to go and start practicing. He's going to be very dangerous soon. Amal, you're there?
Not there, sir.
Not there, gone. Why the patient develop bronchopneumonia, develop arrest or what? Anyway, you say now. Lasima, you say, how do you differentiate?
anaphylaxis History of administration of
No. You are there. The patient says that in front of you, you have diagnosed hypertonic hyporesponsive episode.
Anaphylaxis, there will be hypotension, sir.
Very good. Who's
Hyperresponsive.
answering? Gopika?
Yes, sir.
Yeah, this is the difference. The last time, Lesima, you didn't attend the anaphylaxis class. This is the difference. I emphasized it so much, and you will not find it in books. That's what I am trying to tell you. That is why a 30 pulse can be present in hypertonic. If you write 30 pulse, you're gone. It means it's anaphylaxis. Then you will have to check the BP. If the BP is low, remember if there is hypotension, then it can either be anaphylaxis or vasovagal syncope. Not likely to be hypertonic. Darwin's very rarely they have written hypertonic, hyperresponsive. Child can be pale, but nobody has written hypotension. Okay. Therefore, when there is hypotension, it becomes anaphylaxis, become contraindication. Okay, now read it. Quick. You're wasting time. We are very slow.
A child has a history of persistent, inconsolable crying for more than 3 hours after DTP. What should be done? A. Avoid all future pertussis vaccine. B. Delay all vaccinations indefinitely. C. This is a precaution, but future doses may be given. D. Use only monovalent diphtheria and tetanus vaccines.
Yes, sir.
Huh?
This is a precaution.
Okay, see. That's right. You read it now, Lesima.
A child has a history of persistent
No. Answer. This answer.
persistent crying more than 3 hours, hyperpyrexia more than 40.5 degrees Celsius, or HG are precautions, not contraindication. These events are generally not recurrent and do not cause long-term sequelae.
Please remember, these are very categorical statements they are making. Okay, from where you got this information? That's very important. This is given only so far. I was quoting from CDC Purple book. This I have taken from Piyush Gupta, because he's sticking his neck out and giving you something very practical. You can follow it. If a child has a temperature of 39, probably you can give it. It's not he says hyperpyrexia fever more than 40.5 given. HSG within 48 hours of DTP. What is in the bracket? Can you read it, Lesima, once more?
Events such as persistent inconsolable crying of more than 3 hours duration or hyperpyrexia more than 40.5 degrees Celsius, HG within 48 hours DTP administration, and seizures without fever within 72 hours of administration of DTP are considered as precaution but not contraindication to future doses of DTP, because these events generally do not recur with the next dose and they have not been proven to cause permanent sequelae.
Okay. Now, where did you get the information? You can get it only from Piyush Gupta. Why have I quoted it? Because it's one of the textbooks which is recommended by the National Board, and you are fully justified in following it. Okay. And I even given the page, because in case you have a problem. Therefore, precaution and what is temporary, can you read it? Permanent? Read it.
Precaution: permanent high fever more than 105, persistent crying more than 3 hours, HG after DTP, seizure within 3 days, temporary severe acute illness, receipt of antibody containing product.
You read it, but my question is, what is permanently deferred? Because we are supposed to defer whenever you have a precaution. Now, the temperature 105, I can understand. When during the fever, you won't give it. Persistent crying for 3 hours, what do you mean by permanent and temporary? Precaution is permanent, but the difference may be temporary. Till the crying is over, I cannot understand. If you have HSG, you can give the next dose. Therefore, probably, yeah, that's what you will do, because it is deferred. What do you mean by deferred here? Temporary, because the next dose we are going to give. Seizures within 3 days. What do you mean by differ? I cannot understand that. What is the reaction you will take? You're going to give the next dose. Am I right?
Postpone.
Yeah, tell me. Yeah.
Will postpone till that illness subsides.
Okay. See, the point here is that I thought that high fever, okay, we will postpone 105. This now persistent crying more than 3 hours is after the vaccination. HHE is after the vaccination. Seizures within 3 days are after the vaccination. And therefore, what happens? He comes after 6 weeks for the next vaccine. 4 weeks, he comes for the second dose. You will definitely give it. Therefore, what do you mean by telling it is permanent precaution? What does that precaution, what does it matter? I cannot understand. Temporary, I can understand. Acute illness, you will not give during acute severe illness, not mild, moderate. Recipient antibody protect, yes, I can understand. But this three, I am not very sure. Because if it is
For all
following
vaccines,
what's that?
for all vaccines, we have to take precautions.
That I agree. But what are the precautions? Here, I mean, precautions is every vaccine you should have adrenaline. You should make the patient wait for half an hour. I would say 45 minutes. Take the vitals before you say none of which is done, even in a hospital. None is done in the health service because the A&M goes and gives it at home. None of which is done. But here,
You
what
can
does it-
counsel the parents, sir, that there is a chance for developing the adverse effect in this time also.
so see,
So
it is
they'll
our
be
job.
prepared.
What would do we do? We are creating a fear complex in them. It can happen again. But since because of the, you might tell her, but the benefit to risk ratio is high, we are going to give it. Okay. Seizures within 3 days. We will come into this, a very important point. How do you differentiate with encephalopathy? That's another very important point. Nowhere it is given in full detail. If I ask you the question, you will not be able to answer. Therefore, I don't want to waste that time. We will come to that here. Persistent crying more than 3 hours. You have given a vaccine, the mother comes and says next day the child did not sleep, it cried for 3 hours. Or in front of you develop an HSG or has developed a seizure on the third day. Definitely it is only a precaution and therefore you will give the, but what do you mean by permanent precaution? What does it mean? I cannot understand. Anyway, now let's go to the, now let me tell you hypotonic, hyporesponsive event, or is it episode? Okay, episode is not given in detail anywhere. What is the clinical feature? How will you differentiate from anaphylaxis? No discussion. I have added on to that telling that if there is hypotension, it becomes anaphylaxis. But it is, I don't know why it is not discussed. Now, I took it from wherever literature I could. And this is from the information sheet observed a vaccine reaction by WHO in May 2014. Read it. Can you read?
Hypotonic hyporesponsive episode. A case definition defines an HHE as a sudden onset of lameness and reduced responsiveness and pallor or cyanosis.
Very important. Pallor and cyanosis. Pallor is more in favor of vasovagal syncope. Cyanosis also they have added. But they have not told 3D pulse or hypotension. Now you read the rest now. Read it fast.
In 1991, the review by the Institute of Medicine concluded that there was sufficient evidence available to establish a causal relationship between whole cell pertussis vaccine and HHE. Although HHE occurs most frequently after whole cell pertussis vaccine, the reaction has documented to occur after other vaccines, including diphtheria, tetanus, Haemophilus influenza type B, and hepatitis B. The causes is not known, but recovery occurs spontaneously and no long-term sequelae have been documented. The majority of these infants can be safely revaccinated without a recurrence of the HHE. In addition, the advent of acellular pertussis vaccine has markedly decreased the frequency of episodes of HHE.
Therefore, you're reading in between lines, you can say if the patient develops an HSG, you better give an SLR vaccine. Actually, this is considered as only a mild or moderate reaction, not a severe allergic reaction. For that is, now this information you will not find in Purple Book, you will not find it in textbook, but not even PJ. Therefore, I have taken vital information from multiple sources. That's why when people ask me, why doesn't the PG present? I would say, I don't expect this because this document should become a referral for further talking. Okay. Now remember this what does the, this is from the Piyush Gupta, volume 1, page 132. Now you read the headline here. He has written hypotensive, hyporesponsive episode. That hypotensive is a mistake because anywhere else he has written as hypotonic. It is not hypotensive. He has made a vital mistake in that. But remember, but he has written DTP. What are the features? Look at here. Read here what is written here.
Acute paleness, transient decreased level or loss of consciousness, decreased or loss of muscle tone.
There's no hypotension here. He has made this mistake, a huge mistake here. And what's the treatment? IV fluid and oxygen only, maximum. There's no adrenaline, no hydrocortisone, no dopamine. And if you look at the clinical features, it occurs within minutes. Here it can occur within 48 hours of a DTP vaccine, the DTWP vaccine. Decompensatory circulatory system, hypovolemic shock, laryngeal edema, respiratory, none of which is present in this. Okay, here only hypotonia and hyporesponsiveness. But remember, it will be very, very alarming when the patient suddenly becomes limp and he's not responding to you. Remember that. And here, this is a case definition which is given by the WHO. Remember this. These information are not available on the net very much on the textbooks. Okay.
A patient has a history of encephalopathy following vaccination. Which vaccine is contraindicated? A. MMR, B. Hepatitis B, C. Any pertussis containing vaccine, D. Influenza.
Which is it?
Pertussis containing vaccine.
Okay, doctor. I would ask you what is encephalopathy and what is encephalitis?
Encephalopathy is a syndrome.
Encephalopathy is a syndrome. Encephalitis is a. How do you differentiate between these two? You must have heard during your MBBS days, you must have heard this term 100 times, I'm sure. Have you ever
Decreased
thought?
level of consciousness in encephalopathy, there will be altered sensorium.
Okay, encephalitis.
Altered sensorium, but no signs of inflammation.
How do you know there are signs of inflammation? You can't see the brain, is it not? Well, there has to be a
Any
differentiation.
form of dysfunction, we can call it as encephalopathy.
What's that?
Any form of dysfunction, brain dysfunction.
Okay. Then, well, you must see in medicine as you go along, please understand, Lasima and Gopika, when you go along and you tomorrow you take a rounds and the your PGs come along with you, they will ask you, doctor, what's the difference between it? And you're not able to explain it. They will judge you on that. You know, encephalopathy is something in which you have both have the same clinical features. What is it? Seizures, loss of consciousness, and altered sensorium, everything is a bad thing. Encephalopathy, there is no direct inflammation of the brain. There is no direct involvement of the brain. Therefore, in encephalopathy, for example, hyponatremia can produce Shigella encephalopathy. Why do you call encephalopathy? Because Shigella has never been identified from the brain in these patients. On the other hand, encephalitis is the virus has been isolated and this brain is inflamed. For encephalopathy, there is no direct involvement. Now, my question to you is, any pertussis containing vaccine, you all said, is a contraindication. But we said seizures within, is a precaution. Therefore, how do you differentiate between how do you diagnose a condition as encephalopathy following a pertussis vaccine? We will come to that later. Now, read it.
Encephalopathy following vaccination is a contraindication to any pertussis vaccine. However, diphtheria and tetanus vaccine may still be used.
That's the difference, okay? The encephalopathy for, but in a few cases, therefore you have to know what is encephalopathy. Remember this. But in a few references, they are telling that there is no association of encephalopathy with DPT vaccine. Anyway, that's a different matter. This is again because the accepted book of Piyush Gupta says only what's given in the line.
For patient with history of encephalopathy following vaccination, any pertussis vaccine is contraindicated, and only diphtheria and tetanus vaccines may be used.
Okay, therefore you are going to permanently tell him, don't give pertussis vaccine, not even AP vaccine. Okay, in the child in which Rose referred to, if the patient how do you diagnose whether it is encephalitis or is it he had a uprolling of the eyeball? It could have been a seizure. And the next question is, was it just a seizure or was it an encephalitis? How will you differentiate? How do you know that from the history?
Encephalitis may be the recent history of infection.
No. I am not talking encephalopathy. We are not thinking of the Rose patient. The patient, they gave the health center, they gave a vaccine. The child had an uprolling of eyeball and was not responsive for some time. We don't know what it is. Only probably the A&M or the nurse was there. Was it an encephalopathy? Encephalitis is not there because patient was all right before that. But this is
The child will have altered sensorium as well as
he
prolonged
was not
seizures.
responsive. We don't know whether he had altered sensorium or not. But when do you diagnose it as encephalopathy? Again, I would like to say that if you read Purple book, not given. Given Nelson, if you read Piyush Gupta, I'm not sure it has given. But if you read Nelson, probably I have taken this from Nelson. But when do you diagnose DTAP? He has given contraindication. And read this in the bracket.
Encephalopathy, example, coma, decreased level of consciousness, prolonged seizure, not attributable to another identifiable cause within 7 days of administration of previous dose of DTP or DTaP.
Okay, given in the CDC ACAP guideline of 2023, 2 years ago. Most probably I've taken it from Nelson. I'm not sure you can take it, but even if it is not there, it is from CDC. Therefore, it is the final word. Go and ask your friends who did not attend today, how will they diagnose encephalopathy as a DTP vaccine? You can even ask the consultants. If you had asked me 1 month back, I would also not been very definite. You have to know it. If there is coma, decreased level of consciousness, prolonged seizures, they have not written what is not attributable to an identifiable cause. It's very important because you give a DPT, 3 days later, the child develops a seizure, and after 1 hour, he's all right. It's a febrile seizure. It is not encephalopathy. And within 7 days of administration of previous dose of DTP or DTAP, he should have written DTWP here. I don't know what he meant by DTP or DTAP. Even DTAP vaccine, not necessarily DT vaccine, you diagnose it as encephalopathy and it becomes a contraindication. Okay, unless you find another somewhere else like the WHO or CDC or the Nelson changing this, don't ever change it. Imbibe in your memory. What is encephalopathy is a diagnosis, and it is within 7 days, decreased level of consciousness. They have not written how much will be the Glasgow coma scale. Prolonged seizures. It should not be attributable to another cause, like a febrile seizure or head injury. Then it becomes a encephalopathy. Now we'll go ahead. Read it.
A child with history of anaphylaxis to egg protein should receive influenza vaccine. A, only if skin testing is negative, only in a hospital setting with epinephrine available, with any flu vaccine appropriate for age and health status regardless of allergic severity. Not at all due to high risk of reaction.
It's a tough question. He has developed an anaphylaxis to egg protein. You're going to give influenza vaccine. This is always a problem. Egg protein, we have made it very clear. You go through it, yes.
See.
Yeah.
For inactivated influenza vaccine, egg allergy is not a contraindication. Even those with severe reaction, example anaphylaxis, can receive the vaccines annually, preferably in a medical setting with supervision.
Okay. Now in the practice guidelines, read what is given in the active in the
For inactivated influenza vaccines, egg allergy other than hives, example angioedema, respiratory distress, lightheadedness, recurrent emesis, or required epinephrine or another emergency medical intervention is a precaution. Inactivated influenza vaccine may be administered in an inpatient or outpatient medical setting and under the supervision of a healthcare provider who is able to recognize and manage severe allergy condition.
Okay, they have given it as a precaution, but let me tell you, things have changed very fast. MMR, inactivated polio vaccine, where you can give, of course, you have to take some precaution, not like you have to give admission. They are not telling this. That's only the Purple Book says that it is so a less amount of egg, it does not cause anaphylaxis. You can take it. Previously, yellow fever was considered as an contraindication for egg anaphylaxis, previous history of anaphylaxis. Even that they have now removed. Okay, the Purple Book is little back in the information, but I would say that you have to keep in mind this is what the Purple Book says, that you would say that but it doesn't cause, even anaphylaxis does not cause a reaction, but anaphylaxis to egg does not cause any problem influenza, but it is better to give in a medical setting with adrenaline ready, which you would do in every patient, but not a hospitalization. Don't say about hospitalization. Read it from Nelson. We'll see what Nelson is saying. Okay, read it fast. Why you're taking some time? Can you read it?
Persons with a history of egg allergy Persons with a history of egg allergy who have experienced only hives after exposure to egg should receive any flu vaccine appropriate for age and health status. Persons who had symptoms other than hives, example angioedema, respiratory distress, need for emergency medical services, or epinephrine, should receive any influenza vaccine appropriate for age and health status annually. If using an influenza vaccine other than flu block or Flucelvax administered in a medical setting under supervision of a healthcare provider who is able to recognize and manage severe allergic condition.
This is Nelson's textbook of pediatrics. What it means here is flu block and Flucelvax are actually killed vaccines. Therefore, they are telling when you are giving a live influenza vaccine, if there is you should give it under to recognize manage severe allergic reaction, but this is not given anywhere. There's a ambivalence. Generally now, killed influenza vaccine, even anaphylaxis, there is absolutely maybe a precaution as per Purple Book, but otherwise you can definitely administer. Live vaccine, he says flu block, other than administer medical. What do you mean? These are the two killed vaccines. This is what I could understand. Therefore, this is what is given. Now, again, you come into this. If you look at the Purple Book, which is given, which is outdated a little, read it now.
Children with a history of serious egg allergy should not receive yellow fever vaccines but can safely receive other vaccines, including measles and MMR vaccines. Children with a history of egg allergy.
Yeah. I can't hear you.
Children with a history of egg allergy who had experienced only hives after exposure to egg should receive any influenza vaccine like inactivated, recombinant, or live attenuated without specific precautions except a 15-minute observation period. Children with previous anaphylaxis to egg can receive the influenza vaccine in a center where staff experienced in recognizing and treating anaphylactic reactions are available, and the child should be under observation for a minimum of 1 hour.
This is the Purple Book. I told you that the Purple Book goes by a little earlier reflections, but nowadays they say it is not. Therefore, you better say maximum it can be a precaution, is never a contraindication. Egg allergy, this one. But you know what has happened is in up to date by all the new current, this you don't expect your professors to know about it. Previously, yellow fever was a contraindication with this egg anaphylaxis. Read what is given in the bracket.
Yellow fever vaccine has also been shown to be safe for people with HE allergy, although this was determined more recently,
Egg
and
allergy.
at the
HE
time
is
of this,
hen egg allergy. Okay. Okay.
although this was determined more recently, and at the time of this update, some package inserts may still advise skin testing with the vaccine prior to administration.
If yellow fever is also out of it, but don't put, maybe you may not be able to say because in July 2025, we are in August, I think 1 month ago only it has come, but nobody would know. Again, the same thing says the study. Don't want to read the study. It is written yellow fever can be administered to egg allergic patient without prior skin testing. That is the latest 1 month ago value. Therefore, I would summarize it like this. Previously, egg allergy was considered as a precaution for MMR, influenza, yellow fever vaccine, everything. Nowadays, MMR is out of it almost completely. The other vaccine, if there is anaphylaxis, people said be careful, it's a precaution. Now, even anaphylaxis, it is not considered as anaphylaxis to egg. Remember that. If there's anaphylaxis to previous influenza vaccine, you can't give it. Egg is not considered even a precaution, but the purple book still keeps telling that it's a precaution. And yellow fever, it was considered as a contraindication. Now that has gone off the road. This must be the summary which you should know about it. Okay. This egg allergy is a major problem here. Fast. Read it fast because it's a foolish question.
Which vaccine does not require special handling in patients with egg allergy? MMR, yellow fever, influenza, rabies. MMR vaccine is grown in chick embryo fibroblast culture but contains negligible egg protein. Can be safely administered without special procedures, even in individuals with egg anaphylaxis.
Okay, but actually all this can be given without special handling, especially influenza and rabies can be given. I don't know why they gave it. Okay. Now this is a very interesting question. Okay, read it.
A child with a personal or family history of seizures should be cautious about receiving which vaccine? DTAP, MMRV, Hib vaccine, polio vaccine.
Febrile seizures. No answer. Past history of seizures. Therefore, which vaccine will you be careful? Read it.
A personal or family history of seizures is a precaution for MMRV vaccination due to increased risk of febrile seizures in children aged 12 to 23 months compared to separate MMR and varicella vaccines.
Okay, now let me tell you something about MMRV. MMRV means measles, mumps, rubella, and varicella. All the 4 varicella vaccine. Therefore, previously, in 1.5 years, you can give it as a single vaccine. But generally, even Dr. Anju, when he came in first, told me, doctor, don't give it. A lot of incidents of seizures are coming. Therefore, if at all they used to give it in preschool age. When you are giving the dose at 5 years, they can give MMRV because it doesn't cause same reaction. But the point now is you don't have to worry very much because as far as I understand, MMRV is not available in India now. Western countries, it's available. Therefore, they say seizures is this has been recorded. Now you look at what is the precaution? Okay, read it from the CDC itself.
A personal or family history of seizures is a precaution for MMRV vaccination. This is because a recent study found an increased risk of febrile seizures in children 12 to 23 months who receive MMRV compared with MMR and varicella vaccine separately.
They have not written 12 to 23 months. Therefore, that's the first dose of varicella vaccine. You need not combine. The second dose you may give, but you can't give in India. But remember, the personal or family history of seizures, they develop febrile seizures. Some people have asked the question, if there's a history of febrile seizure, which vaccine you have to be careful? I'm not too sure because febrile seizure, MMRV is a precaution, is not given anywhere. Anyway,
Which of the following is a true statement regarding Arthur's reaction after vaccination? It is a type 1 hypersensitivity reaction. It typically presents as a painless local swelling. It occurs due to antibody antigen complex deposition causing inflammation. It is common after measles vaccination. C. Antibody antigen complex
complexes.
deposition.
What's the type of reaction it is?
Type 3.
Type 3 reaction is a reaction which can occur with the first one. Therefore, how does an Arthur's reaction look like? What is it? I think I told in the last meeting, last conference also we discussed this. Now remember, you are a pediatrician, you come out as pediatrics, a child develops an Arthur's reaction. What will happen? You will send it to the dermatology. The dermatology person might think the reaction to the vaccination should be detected by the pediatrician. He may say this allergic reaction, right, histamine and steroid, and send him home. Therefore, you must know what is Arthur's reaction. How does it look? Gopika, what do you say? Any answer? No answer means don't give any answer. Okay, read it. Can you read it?
Arthur's reaction is a type 3 hypersensitivity reaction involving immune complex deposition in blood vessels, leading to localized inflammation, erythema, and swelling, commonly seen after booster dose of tetanus, diphtheria, or hepatitis B.
Okay, remember this. Okay, it's a localized inflammation of the blood vessels. Now read what is Arthur reaction up to date says. Okay. Why I'm giving you so much? Yeah, okay.
An Arthur's reaction is a localized type 3 hypersensitivity reaction in which antibody antigen complexes that fix complement are deposited in the walls of small blood vessels, causing acute inflammation, infiltration of neutrophils, and localized skin necrosis. Arthur's reactions were initially described in hyperimmunized laboratory animals. Whether significant local reactions to booster doses of modern vaccines are true Arthur's reactions has not been demonstrated conclusively. Typically, such reactions present as painful local swelling and erythema, beginning within a few hours and usually peaking by 24 hours at sites of the booster injections of a vaccine. This type of reaction has been reported with tetanus, diphtheria, and hepatitis B vaccines.
This is how it looks. Okay. It looks like a swelling. Okay. It is a swelling. Wheal and flare type 1. Wheal and flare is type 1. This is type 3 is Arthur's erythematous local swelling. And if there is an Arthur's reaction, what will you do? Now you make a big diagnosis. I'm sure that 99% of the pediatricians will not diagnose Arthur's reaction. I wouldn't have if I had not gone through all this. This picture is from the internet. I didn't find a picture in a pediatric textbook. Very funny. And now you diagnose it as Arthur's reaction, or the dermatologist calls you back and said, "Doctor, you are a pediatrician. You should have made the diagnosis. This is Arthur's reaction." And her opinion about you will permanently be gone. Remember this. All of us are judging each other. Now it is an Arthur's reaction, and she says what you should do. You are given the first vaccine. What about the second vaccine? Usually happens to booster, but can happen even earlier. Okay. Remember, read this, what is given in the pink here. History of Arthur's reaction.
History of Arthur's type hypersensitivity reactions after a previous dose of diphtheria toxoid containing or tetanus toxoid containing vaccine, defer the vaccination until at least 10 years have elapsed since the last tetanus toxoid containing vaccine.
How do you like it? For 10 years, you can't give a tetanus toxoid. Did you know that? And Arthur's reaction is so important to remember. If you have an encephalopathy within 7 days, it's a contraindication. We'll come to a later question. Okay, now let me go back to history of swelling. And what is if there is a swelling, sometimes, you develop an erythema of that after even Tdap or vaccine. What happens is a difference between that and arthrosis. Arthrosis is a localized nodular swelling, or when you have an extensive limb swelling after DTP, it is common. It is not an inflammation, or it's not a cellulitis. And it is a precaution. When is it a precaution? When there's a extensive swelling, an erythematous swelling. Can you tell me? Let's say my child is given injection in the morning. It comes in the evening with the swelling of the legs. It looks erythematous. It's spreading in the thigh. It gave in the thigh, spreading. What will you tell the patient?
Sir,
Yeah. Patient is very angry. The
Yes, it is within 24 hours, it can be an arthritis reaction.
Arthritis is not based on 24 hours or 48 hours. It's based on the fact it's a localized painful swelling. While in spreading like a cellulitis, erythema is very common after DTP vaccine, and it's a normal reaction. It's not an infection. You become worried when it crosses a joint. When you give it in the thigh, it crosses the hip joint, then you are worried. Then it becomes a precaution. You have to consider whether it is arthritis, whether it is cellulitis, etc. Even otherwise, you should be concerned. In the middle of the night, the patient comes with the swelling and redness around the injection site. The parents are worried. It's warm. It's doctor, they didn't vomit. You must be able to tell the patient that this is a normal reaction to DTWP or even Tdap. And if it doesn't cross the joint, it's not a problem. Come tomorrow. You may maximum give paracetamol. Don't treat it as an infection, because then the vaccine and the nurse goes into problem. At least this must be read what is given here. Condition commonly misperceived as contraindication of history of extensive limb swelling after DTP-TD. That is not an arthritis reaction. All this you should have read. It is given in General Practice Guideline for Immunization, CDC, and is given in table form, if I am not mistaken, in Nelson. Remember, read it. Okay? At least see the PowerPoint presentation which I am making. At least come for the class. Otherwise, you will go out as a pediatrician who makes fatal mistakes. You will go and tell the patient, okay, it looks like inflammation. Let me start ampicillin, cloxacillin. Finished. The relatives are unhappy. They give a complaint against the hospital. They give a complaint against the nurse, and the nurse doesn't know that's not a mistake. This is a normal reaction to Tdap. On the other hand, it is a localized swelling. It's a vasculitis. Then it becomes arthritis, and you cannot give tetanus toxoid for 10 years. Remember that. Okay. Read this. Can you read
A
it?
child has a progressive neurological disorder. What is the recommendation for first dose of DTWP? Administer immediately. Delay until the condition stabilizes. It is a relative contraindication. A decision made on the case-by-case basis. Avoid all pertussis-containing vaccines.
What do you say? A child is having a progressive illness like a white matter degeneration or recurrent seizures with, you think it is a hepatosplenomegaly storage disorder. What's the recommendation?
A progressive neurological disorder is a relative contraindication.
Okay, we'll read it now.
Progressive neurological illness is a relative contraindication to the first dose of DTWP. However, children with stable neurological disorders can safely receive the vaccine.
What is a stable neurological disorder, which you will see very often? Commonest, you may get it in the exam. Amal probably got it in the exam. Huh?
Cerebral palsy, sir.
Yeah, non-progressive. But you remember, the lesion is non-progressive, but the symptoms can vary over a period of time. Therefore, when you give a 3-month-old child with cerebral palsy 6 weeks, you're going to do, he may develop a seizure as it goes along because it's the natural history of cerebral palsy. Some of them, especially quadriplegic cerebral palsy and all, may develop seizures. They may attribute it to the vaccine. If I discuss with the patient and say non-progressive illness, there is absolutely not even a precaution. But you must be sure that it is not a progressive neurological illness. Otherwise, the vaccine will get into. Okay, this is again from, remember, what is given categorically is not given anywhere else. That's why I'm quoting from the book, which gives a categoric statement, which is very important for our practice. This is again from Piyush Gupta. That means it's not given in the Purple book. It is not given in the CDC. And okay, read it now.
Progressive or evolving neurological illness is a related contraindication to first dose of DTWP immunization. However, DTWP can be safely given to children with stable neurological disorders.
And progressive neurological symptoms, read what is given in the bracket here.
Progressive neurological disorder, including infantile spasm, uncontrolled epilepsy, progressive encephalopathy, then defer DTAP until neurological status is clarified and stabilized.
Okay, you will have to take the opinion of a neurologist like Dr. Madam and then only decide on it. Okay, don't jump and give it. That's my answer to it. If you are in a primary health center, if Amal was there, I would have told him, refer him to the medical college. Finished. Okay. Read it first.
The child has had anaphylaxis after previous dose of DTP. What is the correct management? Administer, avoid all future diphtheria, tetanus, or pertussis vaccine.
That's the answer. Oh, I given the answer also. Anyway, that happens often. Sometimes I don't know why. Yeah, therefore, when you have an anaphylaxis, is a complication to all the vaccines. Encephalopathy, it is probably a contraindication to only pertussis vaccine. That is according to Piyush Gupta. Read it.
In case of anaphylaxis, further immunization with any diphtheria, tetanus, or pertussis vaccine is contraindicated as it is uncertain which component caused the event.
And if for patient history of encephalopathy following vaccination, any pertussis is complicated. Diphtheria and tetanus can be given. Okay.
Which of the following is not a reason?
Okay, read it. Okay, can you read, one of you?
Which of the following is not a reason to defer vaccination during hospitalization? Current anesthesia or surgery, upcoming surgery, acute illness, routine physical examination. Routine physical examination.
Okay, I don't know what's the meaning of this question. Routine physical examination are not a prerequisite for vaccination. Hospitalization is actually an opportunity to administer mixed vaccine. I don't know what's the relevant answer. I'm not too sure. Are not a prerequisite. I don't know. I'm not too sure, because if you are going to get a child admitted for operation for the chickenpox, and if there is a chickenpox epidemic going on, because the child is going to come in contact with many people, it may be good to update the vaccination. But anyway, that's the answer. Can you read precautions?
Hospitalization should be used as an opportunity to provide recommended vaccinations. Healthcare facilities are held to standards of offering influenza vaccine for hospitalized patients. So providers are incentivized to vaccinate these patients at some point during hospitalization. Current, recent, or upcoming anesthesia or surgery or hospitalization is not a contraindication to vaccination, but certain factors might lead a provider to consider current, recent, or upcoming anesthesia or surgery or hospitalization as a precaution.
Yeah.
Effort should be made to ensure the vaccine administration during the hospitalization or at discharge.
Therefore, the current anesthesia, surgery, hospitalization may be a precaution. Okay. Read it first.
When should vaccination be deferred in a child with mild illness? Always to avoid complication. Never, as mild illness does not affect immunogenicity. Only if there is a fever of more than 38 degrees Celsius. Only if the child has vomiting or diarrhea.
Okay, they had written 40.5 is when you get a moderate here. Okay, read the answer. It's very simple.
Vaccination should not be delayed for minor illness such as URPI, mild diarrhea, or otitis media. Safety and efficacy are well documented in these cases.
This is given from the CDC. What you read now is from the CDC. Now, next question.
What is the recommended action for administering the yellow fever vaccine to a patient with egg allergy? Perform skin testing before administration. Avoid the vaccine completely. Administer in single dose without prior skin testing. Give only if no history of anaphylaxis.
What is it?
Administer in single dose without prior skin testing.
Yeah, that's what is we have read it. Okay. That's what I said, that there's a problem in this. Studies have shown yellow fever can be safely administered to egg allergic individual prior skin testing. Where is it given? It's given in the Purple book. Okay. But what the Purple book has given is something else. Should not receive yellow fever vaccine, but can with anaphylaxis. They have written serious allergy, not even anaphylaxis, including measles, and therefore they should not receive. But that's not what is the latest I told you in the up-to-date has given, can even be given for children with anaphylaxis. I am not too sure that your examiner would know this. I didn't know it till I read about a week back. Okay. Therefore, the yellow fever can be administered to egg allergy. That's what came up in the MCQ. But if you are asked in your NEET examination, I'm not too sure what you should answer. Probably if there's a history of anaphylaxis, yellow fever vaccine should be deferred. Okay. Okay, now.
Which of the following is a precaution to MMRV vaccine? Age less than 12 months, history of febrile seizures, family history of asthma, previous reaction to gelatin.
What's it?
History of febrile seizure.
Yeah, actually, this is a very tricky question. Actually, I'm not too sure. Okay. The what is given in the book is a personal or family history of seizures is a precaution for MMRV. Therefore, probably even the febrile seizure is a precaution, but they have not written clearly febrile seizure is, because it's a big statement. Anyway, due to the increased risk of febrile seizure in young children. Okay, this is the notice personal or family history of seizure that is given in CDC. A personal or family history of seizures is a precaution for MMRV. This because the recent found study increased risk of febrile seizures occurring following the vaccination. They have not written that the previous history of febrile seizure is a contraindication. Anyway, that's a latest step. Anyway, we don't have MMRV vaccine, therefore we are not worried. What is this?
A child develops a large local reaction with painful swelling and erythema at the injection site after the booster dose of TB. This is most likely anaphylaxis, cellulitis, Arthus reaction, allergic contact dermatitis. Arthus reaction.
Yeah, allergic contact dermatitis also is a side effect, I mean, of the extensive swelling you have, but its local reaction is, we have already read this, okay? Arthur's reaction, we have already read this, and we have said that 7 days complication. Now go to the 19th question.
According to CDC or ACIP, what is the status of current or recent anesthesia or surgery or hospitalization regarding vaccination? Absolute contraindication, relative contraindication, not a contraindication or precaution, precaution requiring evaluation. The health workers can find it as a precaution requiring evaluation.
What is the status of current or recent anesthesia hospitalization regarding vaccination? Yeah, read it.
Take contraindication.
Read the answer.
While not a contraindication, current or recent anesthesia or surgery or hospitalization may be considered as a precaution due to the potential interactions or patient stability.
Interaction patient stability. Okay, this is given in actually practice guideline, which they have said, read the what is given in the bracket.
Current, recent, or upcoming anesthesia or surgery or hospitalization is not a contraindication to vaccination, but certain factors might lead a provider to consider current, recent, or upcoming anesthesia or surgery or hospitalization as a precaution.
Okay. Again, the egg allergy is coming. Which of the following vaccine can be safely administered to a patient with egg allergy? Well, the answer is not very correct. I think they have written MMR as the. Actually, you can give influenza and hepatitis A also. I don't know why they have written like that. The incorrect question and answer. If using influenza, that let it go. Now, if you see, they have written here in Nelson's test book that flu block or Flucelvax you can administer in medical setting. If using other than flu block, that means a live vaccine. These are kill vaccine. You give, that's a precaution. They are writing as if it's a precaution. But under the CDC, contraindication and precaution for live influenza vaccine, asthma in person aged 5 years or older is a precaution. And children aged 2 to 4 years is a contraindication who have received a diagnosis of asthma, whose parents or caregivers report that the healthcare provider has told them during preceding 12 months that the child has wheezing or asthma or medical record indicates wheezing. Remember, I don't think that live influenza vaccine is available here. Is it available, Gopika? Will you go and find out? Okay. Gopika, you
Yes,
are
sir.
there?
Yes.
Go and find out in the next class. You tell me whether live influenza vaccine is available. Then it's very important for you to understand that you should not give it for patients with history of asthma. But nowhere it is written that you should not give it for history of egg allergy. Egg allergy, you should not give live attenuated vaccine. But asthma is a contraindication. Below 5 years and above 5 years, it's a precaution. No mention of egg allergy. That's what I've written. Okay.
A child has been diagnosed with an evolving neurological condition. What is the correct approach to DTWP vaccination? Administer immediately to prevent disease. Administer only if no other options exist. Consider on a case-by-case basis, possibly delaying the first dose. Administer only the diphtheria and tetanus components.
Okay. We discussed this just now. What's the problem?
Case-by-case basis, we have to consider.
There is no option like refer it to Dr. Anandam and let her decide. That option is not there. It's a case-by-case basis, but always take a it's a relative contraindication. In fact, let me tell you one thing, that in progressive neurological condition, there's nothing to state that the vaccine will cause any increase in the problem for the patient. If you want to give, you can give DTAP also. But you don't want to put the vaccine in disrepute. That is the reason why they are not giving it. Therefore, unless you are making sure, because the vaccination, relative contraindication, we have already told this, that is page number, I think, is wrong. 62. Okay. Now we'll go to a next question. There, which read it. Can you read it?
Sir,
Both of you have gone silent or what?
which of the following is a contraindication to live vaccinated influenza vaccine? Egg allergy, asthma, severe immunosuppression, fever more than 30 degrees Celsius.
Is it so difficult? Gopika, what do you say?
Severe immunosuppression.
Severe
Yeah.
immunosuppression.
Yeah, we thought of asthma also below 5 years is probably a but when you have say, live attenuated vaccine, all live vaccine, severe immunocompression is a egg allergy is not a contraindication is written here. I don't know how. Now coming to this, child received a.
A child received a blood transfusion 6 months ago. What is the recommendation for measles vaccination? Can be given normally, should be delayed due to passive immunity, should be avoided permanently, requires higher dose.
After a blood transfusion, how long will you delay the vaccination? That's a question because it contains an antibody. We had discussed it in many places. In the Purple Book writes in 2 places 2 things.
Should
But,
be delayed due to passive immunity.
Yeah, how long? 7 months according to them, okay? Passive passive immunity can interfere with measles vaccine response until 7 months of transfusion, because that is what is given in CDC. Can you read it? What's given in the bracket?
A precaution is a condition in a recipient that might increase the risk for a serious adverse reaction, might cause diagnostic confusion, or might compromise the ability of the vaccine to produce immunity. Example, administering measles vaccine to a person with passive immunity to measles from a blood transfusion administered up to 7 months prior.
Here they have written 7 months, but that is not what we. This is from the CDC AP, but it depends on. I have asked this question because it's very important. This is from the Purple Book. We have seen here the RBC washed 10 ml per kg you are giving for IgG, negligible IgG. Therefore, there is no, you can give, there's no delay. Okay. Are we giving, when we give Paxils, are we giving washed RBC? I have asked this question 100 times. Did you find out from the pathology? You are not bothered to find out. It's so important. If you are giving a Paxil with washed RBC, you need not bother. If it is without washing, is adrenaline saline 3 months. Packed RBC hemocrit without RBC 10 ml per kg 6 months. That's what 7 months is what. Whole blood 6 months. Plasma platelet products 7 months. Remember, plasma and platelets are having a higher. This is given in Purple Book. Now, if you are giving a washed RBC, which should be given for, because you don't want other antigens to there, I think they are giving washed RBC. Will you look up now? Okay. Lasima, will you find out and
Yes, sir.
you can WhatsApp me what they have written. All right. Or else next time I also forget. Okay.
Yes, sir.
This is a very simple question. Can you carry on?
Which
Read
of
it.
the following is a true statement about vaccination during illness? Vaccination should be delayed even for mild illness to ensure safety. Vaccination during acute illness may lead to lower immunogenicity. Vaccine reactions are less likely during illness. Fever from illness reduces the risk of vaccine side effects. B, sir. Vaccination during acute illness may lead to.
Well, to the vaccination during acute illnesses may lead to lower immunity. Okay, that's right. Now, immunization, lower immunity, vaccine failure. Okay. But at the same time, however, we want to use or if the patient is a defaulter, we would like to give him if it's a mild illness. That was a double statement, And again, the same question. Can you answer?
A child has a history of febrile seizure unrelated to vaccination. Is this a contraindication to MMRV? Yes, absolutely. No, it is not a contraindication. Yes, only if seizures occurred after vaccination. It is a precaution, but vaccination may proceed. D.
Okay, you're right. It's a precaution, but vaccination may proceed. Okay, this is MMRV 12 to MMRV compared to MMR varicella vaccine. So previously, we used to give MMRV at 4 to 5 years, not at 15 months. But now I think it's not available. Therefore, that problem does not appear here. Now, let me, what I would do is, I finished only 25 vaccines I had written. I'll stop the recording here. Now, I just want to ask you something